Hi, I wanted to talk to you a little bit about childbirth education classes. There are people having babies all over the place. There's, I don't know, millions a year are being born. But yet the statistics of those attending childbirth classes are actually quite low. And I'm not real sure I know why. I think the theory is that either people don't feel like they need it, and, birth is birth, and I'm going to go and have an epidural anyway, and, the doctors and the nurses are going to help me, and they don't feel like, they need to have that. And the myths are, well, all of those are myths. Number one, the doctors are hardly ever there. They come to deliver. They take care of you great during the pregnancy, but when it comes time to deliver, they usually only show up right before the baby comes out. The nurses have other people that they have to take care of. And it might be on a day that you deliver that she has lots of patients, more than just you. And she has to take care of them. And that's her job, is to take care of more than one mom and baby. And now she'll be in and out, but that's just it. She'll be in and out. And then what? Not having that constant, like, oh my gosh, what's going on? What's going on with my body? What's going on with my mind? Why is my partner not doing what they're supposed to be doing? And then the fear comes in. When the fear comes in, the pain comes in, or the tension comes in. And with the tension coming in, the pain comes in. And that is not, we think that that's actually a normal delivery. It's not. Normal delivery in our society is, I'll schedule my cesarean, or I'll schedule my induction, and I'll just show up and I'll have my baby when I actually choose, or when my doctor thinks that I need to have my baby. And I'll go to the hospital and I'll just basically give my body away to what the hospital protocols are. And hospital protocols are just protocols. They're just like, let's just do this for every mom, or if this happens for this mom, then this is what we're going to do. Well, moms don't have a clue, if you don't go to childbirth classes, that you have choices and that your body doesn't belong to anybody but you. And a lot of the times when we are going into birth and have that experience, and especially when it's been anything less than what you expected, because if you don't know what to expect, it's going to be, or be flexible at times that you need to be flexible, you're going to have a little bit of trauma even afterwards. And I hate to tell you that, but that's true. And those that have, there is a correlation as a lactation consultant as well. There's a correlation with birth trauma, which causes some emotional trauma, or emotional trauma causes birth trauma for mom and baby, which in turn is going to cause some nipple trauma and have the sore nipples. And then mom's confidence, where do you think that's going to go? It's going to go down the toilet. It went down the toilet 5 minutes after she, I don't know. So in the hospital, but it happens. So this breakdown of disconnect can sometimes happen even before birth. And ladies, I really encourage you to go to a class. If you feel like things are not for you, or what you're being taught, you need to really look down deep inside and figuring out what's bothering you about the information. Is it just the fact that you don't like the instructor, or the fact that your body is going to be exposed in ways and your mind is going to be exposed in ways that you have never experienced before? You're going to have some sensations that you've never experienced before as well. We don't talk about these sensations. It's, we don't talk about what's normal. We just say, relax, breathe, and you'll get through it. And, and we're not realizing there's all kinds of other components to the story, especially if our partners, if they're not trained in labor and delivery, most partners are not necessarily the best partners. Partners, and let me reframe that before all my partners freak out. Partners are great at being your life partner. They may not always be the best that you need for a birth partner. So coming to classes and going and getting some techniques is going to be the best thing that you can do. The best that you can do. So then that way he's prepared or she's prepared to help you at every step of the way. And sometimes when we bring in a doula in the mix, then dad can really, and grandma or whoever you have, or your friend, whoever's there in the labor and delivery room. So who's ever there in the delivery room is going to be prepared. And so, and if they're not prepared, then you suffer. I don't mean that, and it'd be like, you're going to be, but your emotional and physical needs suffer without having that right support. And again, having a doula there is someone who specifically, her job is to make sure that you're comfortable physically and emotionally, and helping you understand exactly the process of what's happening. Then they help dad, or dad or whoever your partner is, they're the main partner. And so then they can really partner you and be there for you where the doula can't. And that way they can all work together. So you are feeling that, all you do is have to just show up for your delivery, and everything's going to be taken care of by your birth team. So important. The other thing is so important is to get the right birth provider and get recommendations from your friends. You can actually change providers 2 days, a day of, whatever. If someone will take you, you can change birth providers with no repercussions. You have got to have a birth provider who is on your side as well. A lot of OBGYNs and sometimes even some midwives have their own agenda, and they feel comfortable with only certain things. They may not be comfortable with having a mom come in with wanting choices and wanting to do it this way and that way and so on and so forth. And then on the other hand, we need to have someone there. If you're going to be delivering in the hospital, you also need to trust them as well. So if you don't trust them, if you don't feel like they have your back, they don't feel like that you guys are on the same page, it is definitely time to find somebody else who will. And because the OBGYNs are not going to school to learn about natural childbirth. They're not going to school to know what the normal side of birth is. And then so there's this discrepancy. And there are so many amazing OBGYNs out there. I have them again on my DVD at the Beautiful Birth Bundle. I had the best OBGYN in California, who I am her biggest fan. And it makes me cry just thinking about her because she was so amazing to me. And she took care of all of her clients as if they were patients, as if they were their only patients. So if you're not feeling the love, if you're not feeling that connection with your OBGYN or even midwife, it is time to change, because it will be manifested in birth. And I need you to be able to have them be on your team. My OBGYN in California, where I had my last baby, was a rock star. And she made me feel like I was a rock star. She made me feel like I was in control and that my wishes meant something to her. That's not typical with most OBGYNs, even though they're great at what they do. They're doctors and they're surgeons. And so they're not going to all this woo-woo, all about women empowerment and bodies and what's natural, because they've been trained to help the abnormal and been trained to help you in an emergency situation, which thank heaven we have. So childbirth classes. So pick your provider. Go to them. Really important to pick someone that you are going to connect with and follow what they do. And also, it's a way to also connect with your partner in ways. And if it feels like you're not really into it, or he's not really into it, or vice versa, again, it's time to get another class, or maybe start to have that conversation of what's going on, what's the barrier, and be able to work around it. You need to work together as a team. Those that think that all of a sudden they'll work as a team and they haven't had any practice or any skills to work as a team, when it comes to labor and labor finally comes, you're in big trouble. And those partners and that couple, last thing we want is conflict during your delivery. I've seen it. For those that really just didn't think they had, they weren't prepared ahead of time. And it makes a very hard delivery for mom. So get dad to a childbirth class, get yourself to a childbirth class. Again, I do private classes in your home if you are in the Utah area. And also I have an at-home study course that's basically the same thing, but more, much more. It's kind of like a combination of a childbirth class and a doula, all packaged into one to help the both of you be prepared, know exactly what to expect and do. So I encourage you that way as well. Also, another tip is if you're not really into relaxation and breathing and all that good stuff, it is absolutely vital for you to learn some form of relaxation before labor. So if you go to yoga, prenatal yoga, great. You're one step ahead of the game. Listening to relaxation music daily or relaxation exercise. Again, like what my Beautiful Birth Bundle CD does. But you can find others. They're out there. And if you are in hypnobirthing classes or hypnobabies, I believe they have their own CD for that to help you. So encourage you to find a relaxation CD and listen to it daily. And I don't come across it very often, but some people don't like massage. Massage reduces the stress levels in your body, relaxes you. And again, that's going to take away your fear, which takes away the tension, which takes away the pain. So relaxation and just having a full body massage and getting dad to touch you or partner to touch you is really, really important. And practice that before labor, not just at labor, so you kind of know what feels good and what not. Because if he's doing something or she's doing something that you don't particularly like, then the worst thing you can do is, tell him in labor, okay, I don't like that. And in labor, you have the right to change your mind anyway. So, but practicing beforehand and knowing and telling your partner, giving them the feedback of, yes, I like that, no, I don't, or whatnot. Some people don't like massage, and that happens. And those women really they do really well on their own, but they do need to breathe. And they feel like, oh, I don't need any help with breathing, and I don't like that kind of thing. I'll tell you that breathing is the number one way to reduce your fear, reduce the tension, and reduce the pain. And get your mind focused is another thing. And I'm not talking about all the hee-hee-hoos and all these strange breathing patterns that are out there. Lamaze used to have that. It's old. It's outdated. And they don't do it anymore. At least when I was certified in 2000, they were doing away with all those breathing patterns and breathing in slowly and evenly, kind of like what you learn in all the childbirth education courses. That's what you're going to continue to do. And if I can tell you one tip about breathing, it's a mind game, and it's hard to do it throughout the whole time. It's hard to remember to do it. So that's, again, why you need to have and practice these skills way ahead of time. When people would come back to my childbirth education courses, we'd have a reunion. And so the past class would come in and talk to the current class. And hands down, the breathing was the number one thing that they enjoyed and that they applied, whether they were going to have an epidural or not. Breathe. Practice breathing, practice that relaxation, and again, whether it's massage, whether it's visualization, whether it's coming up with your own technique. I have moms who have done math equations in their head during birth. That's what helped them. I have other moms who were praying and holding their rosaries and rocking back and forth in a rocking chair. That was their rhythm. But knowing what your backup is going to be and have a plan. I'm a big planner. So if one relaxation technique doesn't work, then we go with number 2. I thought I would love to listen to my relaxation CD during birth. And also, I thought I would love to be seen on the birth ball. I had a couple of doulas at my birth. I had a natural delivery. I just had it all. I had everything planned. And also at the time I was hypnobirthing certified as well as Lamaze and a lactation educator. And so I knew I had, I was now teaching it and a doula for many years at this time. And I hated the ball and I hated to listen to my relaxation CD during birth. But I know for a fact, because I practiced that daily and listened to my relaxation CD daily, as also being familiar with the ball, the birth ball, I was prepared in labor. And that brought me to where I could go to another place in my mind because I was listening to those relaxation techniques. And I already knew where and what I needed to do in my head so I can continue to breathe, continue to relax, and continue to get rid of the fear as well as my tension and then the pain. And that's how I did it. That's how I did a natural birth. So I encourage you to have those things taken care of. Going to a class, okay, let's recap. So going to a class, picking the right provider for you, someone who is on the same page. Your body belongs to you and to nobody else. And also partner needs to be prepared and needs to know what to expect so you can be taken care of. And then also some form of relaxation is vital, ladies, vital. And again, it will look like different to everybody, but find something that you're going to practice daily. And I promise you, after all the deliveries that I've seen and all the years and that I've supported women, having those important key concepts are absolutely life savings between the difference of those that had an okay birth to traumatic birth to like, oh wow, okay, I'm a rock star. So that's the difference. So find someone that's going to be able to help you become a rock star in labor. And again, that's what Birth and Breastfeeding Solutions is all about. And also encourage you, if that's not floating your boat, to find somebody else and find another method that you feel like you can relate more to. I just want you prepared, and I want you to have an amazing birth experience. And I know you can. So with the tools that I just provided for you. So go and sign up. Sign up for the Beautiful Birth Bundle. Sign up for a private class, or find another class that you're going to attend, and always refer back to that Beautiful Birth Bundle that I've created just with you in mind, so you can be supported and have all the support that you need, because you deserve it. And we're in the year 2013 here, and there's no reason for anybody to have that disconnect in labor, and that disconnect, because that will continue on with the breastfeeding, and it will also continue on as a mom. And so start now, be prepared, you can do it.